Studies have shown that in patients with type 2 diabetes, inhibition of the sodium glucose cotransporter 2, or SGLT2, reduces the risk of hospitalization due to heart failure. The mechanism by which this occurs is not yet understood. It's been hypothesized that SGLT2 inhibition may prevent heart failure complications, even in the absence of diabetes. In this multicenter randomized placebo-controlled trial, 4,744 patients with New York Heart Association Class 2 to 4 heart failure and an ejection fraction of 40% or less were randomized to receive either Dapagliflozin or placebo in addition to standard heart failure therapy. Randomization was stratified by the co-diagnosis of type 2 diabetes. The primary outcome was a composite of a first episode of worsening heart failure or cardiovascular death. Over an 18.2-month median follow-up, the primary outcome occurred in 16.3% of the patients receiving Dapagliflozin, as compared with 21.2% of those receiving placebo. The findings were similar in patients with or without diabetes. The rates of adverse events were not significantly different between the two study groups, with volume depletion and renal dysfunction being the most common. The authors conclude that in patients with heart failure and reduced ejection fraction, Dapagliflozin reduced the risk of worsening heart failure or cardiovascular death, even in patients without diabetes. Full trial results are available at NEJM.org.